The definition incorporates things that aren't seizures. And the second problem is that things that we recognize electrophysiologically as clear-cut seizures, no doubt, sometimes produce no symptoms or signs. So these are clear electrographic seizures, but in neonates, maybe as many as half of electrographic seizures produce no observable signs, and of course neonates can't report symptoms. In adults, sometimes you can pick up subtle abnormalities with what we think of as subclinical seizures, or some people have called electrographic seizures, but they are electrographic, they're subclinical, and testing might pick up something, but sometimes even with testing you're not aware of anything. So in one sense, the definition of seizure technically incorporates things that clearly aren't seizures, spikes and high-frequency oscillations, and in the other sense, things that are clearly seizures by EEG don't fit the definition.